Alfuzosin is a prescription drug generally administered to aid urination in enlarged prostate medical conditions like benign prostatic hyperplasia (BPH) in males. It belongs to category of alpha blockers, so it helps to relieve blocked urination caused due to prostatic enlargement by relaxing the associated muscles. Because of its blood pressure lowering property, it may cause fainting and headache. It is only available in the form of prolonged release tablets. Doctors usually prescribe it to patients suffering from painful, troubled, and blocked urination due to prostatic enlargement. It acts on muscles involved in urination and helps in bladder emptying by relaxing those muscles. Its extended release administration helps in maintaining consistent drug effectiveness for a long duration.
Now coming towards the pharmacokinetics of the alfuzosin. It is an extended release tablet which is given as 10 mg daily dose. Now here comes a question, what should we do if we miss a dose? You should take the missed dose as soon as you remember, but if it's the time to take your next dose according to your schedule, then you should take the new dose instead of the forgotten dose. Alfuzosin is administered orally and readily absorbed in the gastrointestinal tract. Its bioavailability increases when given with food up to 50% or higher, and it reaches its peak concentrations in 1 to 2 hours. Its protein binding is moderate and ranges from 82% to 90%. It has a sustained release over 20 hours. Alfuzosin undergoes extensive hepatic metabolism and is converted into inactive metabolites by CYP3A4, which is the main hepatic cytochrome enzyme which partially digests it, and it is eliminated mainly in feces, which is 75 to 90%, and in minor renal excretions. The elimination half-life of alfuzosin after oral administration is 5 hours.
Now I will discuss dynamics. Here is the target organ like bladder, and alpha-1 receptors are present, which are G proteins coupled receptors with 7 transmembrane units. These alpha-1 receptors can be activated by norepinephrine. Basically, norepinephrine is sympathetic mediator. When it acts on alpha-1 receptors, it produces contraction. Norepinephrine can bind to alpha-1 receptors with phospholipase C system. So by activation of these receptors, phospholipase C is stimulated, which can cleave phosphatidyl inositol biphosphate into two important components. This phosphatidyl inositol biphosphate is going to be cleaved into components IP3 and DHG, diacylglycerol. This IP3 can act on the internal stores, so within the cell, the sarcoplasmic reticulum is going to store the calcium, and this calcium can be released through IP3 receptors. Now the IP3, which released as a secondary messenger, can act on the IP3 receptors and activate the internal calcium from the sarcoplasmic reticulum, and diacylglycerol can activate the protein kinase G, which can stimulate inward going calcium channels. Now calcium can more enter in the cell, and intracellular calcium level increases. When intracellular calcium level increases, it produces the contraction of the smooth muscles. Now let's see how alfuzosin works. Alfuzosin can inhibit the alpha-1 receptors activity, and it can prevent the contraction of the prostate and bladder neck smooth muscles. So by the inhibition, and it causes vasodilation and improves the urinary flow, so the symptoms of the benign prostate hyperplasia are improved.
Now I discuss about the most usual and unusual uses of alfuzosin. Here the most usual use of alfuzosin is that the treatment of benign prostatic hyperplasia. Alfuzosin is primarily prescribed to treat BPH, a non-cancerous enlargement of prostate gland that can cause urinary difficulties in men. So alfuzosin relaxes the muscles of prostate and bladder neck and improves the urinary flow.
So here are some unusual uses in which alfuzosin can treat condition by relaxing the urinary or blood vessels muscle. So the first one is chronic urinary retention. It may be used in managing long-term urinary retention, a condition where the bladder does not empty completely. Then facilitating urethral stone passage. Alfuzosin can help in the passage of kidney stones by relaxing the ureter. It is also used in female urinary disorders. While mainly prescribed for men, it has occasional use in treating urinary disorders in women and also treat a specific condition like bladder outlet obstruction. Then adjunct in prostatitis. It can sometimes be used as a supportive treatment for prostatitis, which is the inflammation of the prostate. Also support in catheterization. Alfuzosin helps in easing urinary catheterization by relaxing the muscles of the bladder and urethra. Though not a primary treatment, alfuzosin may aid in certain cases of high blood pressure. Moving towards the toxicological profile of alfuzosin, highlighting its mechanism of toxicity, acute and chronic effects, and drug interactions. First of all, the mechanism of toxicity include alpha-1 adrenergic blockade. Alfuzosin works by blocking alpha-1 adrenergic receptors, which relaxes smooth muscles in the urinary tract. However, excessive blockade can lead to severe hypertension, low blood pressure, and cardiovascular complication. Then moving to the acute toxicity, which are the immediate effects after the overdose. So overdosing on alfuzosin can cause symptoms like dizziness, weakness, and fainting due to excessive blood pressure reduction. In severe cases, overdose may lead to prolonged hypertension, which can be dangerous and require medical intervention. Now the chronic toxicity, these are the long-term effects after the overdose. So it includes hepatotoxicity, which is the affection of liver function, potentially leading to the liver damage. It increases the level of enzyme in the liver and can cause specific conditions like cholestasis, which is the inflammation of the gallbladder and block the bile flow. Then the cardiovascular effects. Prolonged exposure may cause heart-related side effects such as abnormal blood pressure and irregular heart rhythms. Then the toxic epidermal necrolysis, a rare but severe skin reaction that can cause extensive skin peeling and blisters requiring immediate medical attention. Then drug interactions. CYP3A4 inhibition. Alfuzosin is metabolized by the CYP3A4 enzyme in the liver. Drugs that inhibit this enzyme, such as ketoconazole, can increase alfuzosin levels in the blood, raising the risk of toxicity.
Now let's talk about some precautions of alfuzosin. Excess dose should not be taken as it may cause hepatic impairment. Grapefruit juice should not be taken because it may increase its level in blood, leading to toxicity.